They are the most vulnerable members of our society, but many are forced to fight for their lives from the moment they're born. The number of babies suffering from prescription drug withdrawal is skyrocketing in our area. The Department of Children and Families is trying to keep up with the problem. In this exclusive report, I took a closer look at the issue. The problem of prescription drug abuse is now considered an epidemic nationwide, but doctors in Florida prescribe 10 times more oxycodone pills than every other state in the country combined. Those powerful pills are creating new problems for those in charge of protecting our children.
The past couple of years, the numbers have skyrocketed. We're seeing a huge increase in the number of babies in the NICU that are substance-exposed babies.
Robin Jensen's worked as an attorney for the Department of Children and Families for 11 years in Florida. She says investigators receive anywhere from 5 to 15 reports a week from local neonatal units about babies suffering from withdrawal.
On the PI side, the investigation side, they have housed an investigator at the hospital to deal with these newborn babies.
The increase in the number of children removed from homes due to prescription drug abuse in Sarasota County is staggering. In July of 2009, nearly 3 kids out of every 1,000 were placed in a safe house while their parents went through treatment. This past September, that number was up to 9, well above the state average.
Many of the investigators were going to the hospital due to the positive babies that were being born. So we actually collaborated with Sarasota Memorial Hospital and housed a child abuse investigator at the hospital.
All of a sudden the baby starts becoming very irritable, very fussy, starts developing a temperature, doesn't want to eat. If it's not recognized, these symptoms can get worse when the baby goes home, to the point that in some cases the baby can develop seizure activity and could potentially die.
Tony Napolitano is the medical director at Sarasota Memorial Hospital's NICU. He says many times babies don't show signs of withdrawal at birth, and if mothers don't speak up, the risk can be deadly. Are all hospitals looking for this type of thing?
Unfortunately not. I think here at Sarasota Memorial we've recognized what to look for, but not everybody is recognizing it, and not all mothers are forthcoming and letting the physicians know that they've been using medications that could hurt the baby.
And when it comes to the bottom line, everyone in society is paying for this problem.
A baby that's born normal, it's about $4,000 medical costs. A baby that's substance exposed is about $23,000. So you can imagine how that impacts every part of society.
Mia McCormick, SNN, Local News 6. Well, the number of babies born addicted to prescription drugs has increased 85%. While the problem runs across all cultures, the number of addicted white babies born at local hospitals is up 2,400%. Also, not every hospital checks for prescription drug abuse, and the babies may not receive the help they need until it's too late.